So let me ask you this. Somebody gets diagnosed with cancer, right? And they're a Christian, and they show up in the doctor's office, in your consulting room, and they say, doctor, it is one witch in my village. You've just diagnosed me with cancer, but I'm going to go to my pastor.
I tell them, God is not against medical treatment, number one. Then number two, when you get healed, when you come to me, and then I probably recommend 1 or 2 tests, it will be obvious that you're healed. It will be obvious.
Not consider it like I'm not having faith. So it's either God or nothing.
If you're not getting healed, while you're believing God for the healing, why don't you take the treatment? I remember this woman then going to 10 years ago, but she came in with advanced breast cancer, with tumor in the liver and then in the lungs. And then what I did is that I was like, okay, what should I do, Lord? I prayed about it. And then the last I combined this drug. I've given her 2 lines of treatment. In fact, the second line, I saw another node showed up in the liver. It's as though the thing just remained the same.
Liver, that's stage 4 already.
That's stage 4 of breast.
Oh my. The other thing I want to talk about is about medical tourism. Like, what does that look like for you, or generally in Nigeria, even the medical tourism for cancer?
2018, 2019. There was a great shift in the oncology practice in Nigeria because at that point we started having centers that you can call comprehensive cancer center. We started having radiotherapy machines in more than in one place or in multiple places. People don't have to travel from all the other states to one state just to be able to have access to radiotherapy machines. So that changed completely. Although there's still a big room for improvement in that aspect. But I want to say this. In 2018, 2019, radiotherapy machines in Nigeria increased. And then for the first time in the history of West Africa, we now have PET CT scan. You understand? Yeah. Going to about 3-4 years now. And that's the center where I work. It is the first and the only PET CT scan as we speak. So
in the country or in the region in West Africa?
In West Africa.
Hi everyone, I am Dr. Kike Oduba. Thank you so much for joining Health Echoes today. I have with me Dr. Adeoluwa Adeniji. He was a colleague and still a colleague of mine, but we used to go to medical school together, had several conversations together. I remember one of the things we did together was evangelism, right? We were going to school to learn medicine, but at the same time, we were telling people Jesus heals, Jesus says. All right, so welcome to Health Echoes, where we shine a light on the pioneers and innovations driving healthcare across Africa. Today, we're honored to have Dr. Adeoluwa Adeniji, Chief Medical Director at Make-Cure Cancer Center, which is the first comprehensive cancer hospital in West Africa. He's a seasoned clinician and a radiation oncologist. Dr. Adeniji is on a mission to transform cancer care and improve outcomes for patients in Nigeria. From cutting-edge treatments to addressing the challenges of cancer care in the region, this is a conversation you don't want to miss. Join me in welcoming Dr. Adeniji to the show. Welcome.
Thank you for having me, Era.
Absolutely. Of course, I know you as Adeolu, so Adeoluwa, it's been so many years since we've both been at this, trying to learn, the medical profession. Of course, medicine is an art. It's very subjective. And also, it's something that you have to continue to grow and learn into. And what I found is that you have pressed forward and maintained the same level of integrity, the same level of passion for medicine. And also you've, essentially created a pathway for other doctors to kind of follow. Can you tell us about that? How your journey started, what drove you, and how you came to be who you are today?
Okay, thank you very much, Kike, and thank you for having me around once again. So a quick one to say. I would like to say that the idea of or the thought of being a doctor wasn't part of my journey at the beginning. So I wanted to be an engineer. I wanted to be an electronics engineer. And I actually started, the whole journey.
Really?
Yes. I was in Yabatech studying electrical electronics engineering.
Yeah.
Someone just spoke and said, "Oh, Adeoluwa, you are so good with, all this mathematics and everything, and you're so brilliant. Why don't you go and study medicine? They need people with that kind of brain." I was like, what is this one saying? I don't want to see blood. All this kind of.
Yeah.
But the thoughts, what the man said to me that the thought of it didn't leave me for days. I couldn't even sleep. One of those nights, just thinking about becoming a doctor. I'll go back and write the UTME. Then it was jam. So then study medicine, see dead bodies, touch blood. I'm not sure I'm ready for all of these things. And then I remember my dad said, I did go and study medicine. I want you to be a doctor. I said, no, I want to be an engineer. So eventually I was in Yaba Tech when I decided to go back to write the exam. And thank God the result came out very well. And I was in Unilag, so graduated and I became a doctor. And when I became a doctor, I just felt, okay, what else will I do? I wanted to be a pediatrician at the beginning. Then later I switched my mind. In fact, at the beginning, I wanted to be a neurosurgeon. You know why? The gifted and everybody fell into that
I
trap.
wanted to be a nurse.
But when I was in med school, I saw the kind of work, neurosurgeon, they would go around the clock. I said, no, 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 I don't want to experience this kind of life. So then I switched to, pediatrics. I changed my mind, then switched to internal medicine, changed my mind. I remember during one of our internship, rotations, I was in oncology. And then one of the senior consultants there said that, oh, you guys can come in and do oncology. We need specialists in oncology. Just like the experience I had when I wanted to change to medicine, what the man said to me, the doctor said to me, didn't leave me for days. So, at the point I began to say, okay, this is how God speaks. So I went into oncology, the primary exam, everything went very well. And I got the overall best result, part one, part two, even in research and everything.
I'm not surprised at all.
So it was so straightforward for me. And I think I spent not up to 5 years, I was done. And God helped me. And after that, I just felt, okay, what else again? I thought to myself, I need to have some postgraduate exposure. And I've always been, in the positions, uh, I would just say I've always been, in the position of leading people. Let me put it that way. I've been a pastor, you know, from very early age. And then I've been leaders, captains. Even I remember when I was in primary school, I was my class captain from primary four. So that leadership, I was like, okay, I need to. And anything, even in medicine, when I practice medicine, it shows that, okay, this guy is not just a doctor. He has some leadership skills. I said, okay, let me go for my MBA. So I went for MBA and I got my MBA. And I remember I worked with Luth briefly after becoming a consultant, then moved to Lakeshore Cancer Center, then moved to Maseroth Cancer Center. And I remember at Maseroth, they just were like, oh, this guy is different. You understand? They didn't give me that position, but they gave me the responsibility.
Yeah.
And thank God I was able to do it very well till I left the place. And when I got to Mikio, they were looking for consultant specialist. But the first time I talked to the group chairman, he went to tell the board, he said, I have found a doctor that is quite unique. He said, this doctor is different. He wants, this is his bill. It's quite, we have never given anybody this kind of bill, but I want him, give it to him. And everybody like, you want to pay this doctor? Even the seniors here, they've been here for over 10 years. They don't. He said, I have talked to the guy, it's different. He will give us what we want. Give him the bill. So I was employed. Eventually, I became the chief medical director.
Wow.
And it's been an amazing journey since then.
I can imagine. And I know your patients think very highly of you, just like your, group chairman does, because I know you're an excellent doctor. You've always been, even from medical school, even when we did all our rotations, you were very, very meticulous. You were, you truly cared about the patients, right? And you never turned your back against any patient. You wanted to make sure they got what they needed. And I can imagine how it's trickled down into how successful you are today. So for other doctors, who are trying to, break into different aspects of their careers, walk that journey, right? Because not everybody gets to be as, blessed as you are. Not everybody is as hardworking as you are, and not everybody knows the kind of challenges there are in healthcare, but they want to do what you do, right? So to doctors who are trying to, early career doctors who are trying to break into working in oncology or even becoming a leader in healthcare, what would you say the journey should look like? What would you advise them to do as, a burgeoning or a new person trying to navigate the healthcare career?
Okay, thank you very much for that. This is an interesting question, and I strongly believe that many people need to, you know, appreciate the answers, the responses, that will come from different people. Uh, I remember when I learned something very early that if you want to be great, all you need to do is to build capacity. When you have the capacity, you don't need to tell people that you are this, it is show. So if you want to be a good leader, you want to stand out, just build the capacity. At the beginning, things may not be obvious, but over time, it will become obvious that you can do this. And then you have these things to give. So, for example, if you ask someone to do something, just give them the responsibility and see who is going to do it, differently. Who is not going to just, follow the routine. Someone who is going to think outside the box. Someone is going to come with some innovations. Someone will make the difference. And then someone will give the output that you want with so much efficiency. It's about capacity. So, number one, people need to read. It's a lot of hard work to build capacity with a lot of discipline. So people need to read. People need to keep moving. I love, when I tell myself, I think you have to keep moving. For example, I was so busy when I took my MBA program. I was so busy. I did that with Nexford University. So I was like, where is the time going to come? But I said, no, by this time in 2 years, I must not be the same. There were nights I didn't sleep, and I would go to, work the following day just to ensure that, I was able to meet my KPI. You understand?
Yeah.
The assignment will be marked, everything will be marked. And if you don't submit when you're expected, zero.
Right.
So it's discipline, then build capacity and keep moving.
When you say build capacity, do you mean in the sense of upskilling yourself?
Exactly.
Yeah.
And then part of building capacity has to do with mentorship.
Okay.
For example, if you want to develop a particular thing, let's say capacity, you have to look at people that are ahead of you doing the same thing you want to do. When you look up to them, you look at them from afar, and even when you come near, you are inspired. Then you can also learn from them. So, okay, how can I make it a lot easier? And these are things, for example, I mentor a lot of people, even in oncology as we speak. A lot of people say, oh, Ade is, maybe because I look young or something like that. Like, he's a young consultant or something like that. But if you look at the number of young oncologists now, even the ones doing residency, you can see a lot of the people that I mentor, many of them, I'm telling many of them, they are there. In fact, I remember the first guy I mentored in oncology. He's a specialist now, he's a consultant now. I said, oh, that's my mentor. And I remember how he came. He said one day he was just praying, Lord, what should he do? And then he had this dream. And in the dream, he saw that I was going ahead. I was just moving. And he just heard the voice, said, follow him. That's your mentor. So he came to me and said, I want to be an oncologist. I said, okay, go and read this, go and read this. He wrote the primary part. Today, he's a specialist, he's a consultant.
Wow. Wow.
So, and I have a number of them. So, mentorship is very important. It's not everybody that will know automatically what they should do. And some of us have the wisdom and the gift of just knowing certain things. Maybe I'll call it foresight. You just know certain things to do ahead before it becomes common. For example, I just felt, okay, leadership, I need MBA. I don't just want to be a leader without. People need to know that, okay, this guy is good and he also has qualification. And then I went for it. But now when people say, are they as the fellowship, both fellowship has this and that, then he also has this. So that means he's well positioned. Now I see a number of people, including oncologists, trying to chase MBA. And then they just felt like, oh, he's young, but he's the chief medical director. I get to hear that even in the consulting room. It's like, are you sure you're the chief medical? From patients, from
Yeah.
people coming around, because like, oh, meet our chief medical director, and then they come into the office and like, oh, we're expecting to see one gray man. I like, no, sorry. I said I may look young, but I have experience, and I have the wisdom. I have the capacity. And at the end of the day, they will leave the office, like, wow, this guy
He
is
knows his
up for it.
onions.
Exactly.
Wow, that is impressive. That is impressive. Just the fact that you're willing to bring up other doctors to follow that pathway. Because one of the things that makes people leave the profession or even exit the country is a lack of sense of direction. They're like, oh, I don't even know how to navigate this. How do I become that? And they're like, you know what, let me just go look for greener pastures. And the essential is just leave the country. So thank you for all you do. It's just so inspiring, the journey you've walked and how you're pulling other people to walk that path as well. So let's segue into oncology itself, right? Oncology is such a diverse, field in the sense that it's about cancer, right? Cancer of any part of the body, correct? And you could specialize in maybe colon cancer or brain cancer or uterine cancer, right? But you are more of a specialist for and a consultant for all kinds of cancers. Is that correct?
Many kinds, yes.
Many kinds of cancers. Okay, let's say many kinds, yes. And so I want to talk a little bit more. Like I want to address people, like regular people who are not medical. For someone who has cancer, right? What is the first thing they should be doing? For somebody who has just been diagnosed, what is the pathway to seeing someone like you? How do they get help? And is cancer a death sentence? Everybody's just so scared of cancers. Even us as doctors, when we hear cancer, we're like, okay, tell us more about cancers and oncology, your field. What should patients' in immediate reaction or action be if they've been diagnosed with the cancer?
Okay, thank you very much for the question. This is something that people want to know, because I've seen a number of patients. I mean, so many. And when they come into the consulting room, you can literally see the fear. It's as though, what is the doctor going to say? And I've also seen patients, practically shouting for joy, praising the name of the Lord because doctors say, oh, we can't find any cancer. And then a patient who probably walked in happily, and she was like, oh, sorry, the cancer has moved to this. But I'm like, wow, so the end of life has come. You can see it. So when I'm in the consulting room, I know I am dealing with, situations that are not just medical, that like malaria and everything. Is going to determine if people feel, oh, the end of life has come, or they will be happy or not. So there is a way I try to approach it. The first thing they need to know is, number one, they need to understand what the current situation is. For example, if someone has, let's say, stage 1 cancer, very early stage, curable, and the person comes in with fear, you need to let the person understand that this cancer is curable. So as much as possible, all you need to do is to understand what the cancer is and the treatment. You need to do what is expected of you. So I let them know that. And then as much as possible, I also spend time, I like one-on-one attention, one-on-one care. The medical officers that have worked with me, they always say, oh, but Daddy, how do you do this? Because a patient can say, oh, this person said it. By the time they're leaving, they're like, wow, thank you. So maybe it's a counseling skill I got from being a pastor. I don't know. But I just know that sometimes I just know what to tell them, how to initiate the conversation, where not to touch at and then where to end it. I want to be sure that they are able to understand what is going on. And the cancer is not, death sentence. And then when the people that come in with advanced cancer come in, there's another conversation for that. That, okay, there's still hope as much as possible. So that is it. They need to know, number one. And also, there's another part that they need to know is, what does it take to get the treatment? Sometimes the cost is huge. So it's not just about saying, okay, get the treatment, but do they have the means? So you have to prepare their mind. In case they don't have the money at that point, would they be able to, talk to people? Would they be able to, would they need time to gather funds and things like that? Do they need to reach out to maybe a group of people, their associations, and so on and so forth? Because some people just feel, okay, what's the treatment? Let's treat. But by the time you give them the bill, they're like, wow, they are not ready for this. So they need to understand that. Then another thing they need to know is, how long is it going to B. In terms of treatment to start with. For example, there are some cancer treatment that can take years because you know that over time you may need to switch the treatment. So the patient has taken treatment, let's say for 3 months, for 4 months. Now you're saying we need to switch to another one. Or the patient takes treatment for 6 months and is fine, and then they think that is the end. You need to explain to them this cancer can still come back because it's already advanced. Sometimes you're able to tame the cancer, let me use the word tame, or stop it or reduce it significantly. But it doesn't mean that it may not grow back. Sometimes after 6 months, 1 year, 2 years, the cancer starts growing back. So they come back, with disappointment, like we thought that was all. No, so they need to understand what is going to happen, going forward. Then after that, you be able to help them by also telling them if they need, support from the family. Most of the patients that have cancer will need support from the family, not just financial support, emotional support, physical support. And then there is another thing which I also help the patient with because of time is to let them know that, okay, you have access to the medical team. That is the gap I have seen when it comes to medical care in Nigeria. It's a whole lot, especially with public hospitals. Patients will come in, take treatment, they go home. You know that the treatment can give them some side effects. And some of these side effects can kill them if they don't come to the hospital. For example, the white blood cell count is crushed. They need to be checked. They need to get the filgrastim, the booster, quickly and things like that. They stay at home. Then they rush them back. By the time they rush them back, they are gone. Or you try to treat, infection, and at the end of the day, they will spend more money to be able to recover, or they don't even recover at all. So that one-on-one attention is very important. So they can reach the doctor. Even if the specialist is busy, a lot of people are calling and things like that. You also have some leadership commitment. But you need to build a system. That's what leaders do. They build structures, they build systems that ensure that, processes are being carried out, even though they are not there. So you have to build a system. They should be able to reach your nurses. They should be able to reach your medical officer. They should be able to reach people that can get your attention quickly. Because I've trained the medical officers, even if you don't see me, they will attend to you till I come. And then when I see any call from them, I give it a priority. You understand?
Yeah.
So that one-on-one attention is important when it comes to cancer care. Sometimes the patient will cry in your consulting room. You don't rush them out. You give them something to wipe the tears. Sometimes you pat them on their back. Sometimes you just listen to them. You don't say, oh, I have a lot of patients outside. You just allow them to, to speak. And then when they're done, then you help them out. And at the end of the day, you turn out to be one of the best doctors in the world. That is the truth. And although there's time management, there has to be balance. But patients need, one-on-one attention. They need to understand what is going on. They need to be able to reach out. They need to know what to do at every point in time. I will stop there.
No, I think it's just so fascinating, to listen to you, especially the personal touch that you put into your care for your patients, especially people who have cancer. I mean, a lot of people consider it, a death sentence, and it's not. Like you said, not. Many cancers are actually curable, especially if they are caught early. And so, as I know, Nigeria doesn't have too many. We're not great with preventive healthcare, right? People don't go for screenings. People don't see doctors until it's bad, until something goes really bad. They have symptoms, and then they're like, "Wait a minute, that was cancer." And that would make I would like to segue into the next topic, which is the spiritual aspect, right? You being a pastor, you've seen it all, right? When it comes to the miraculous, and also when people are, essentially not believing for a miracle, but then they don't see the results. And at the same time, you've also seen as a doctor, people get well by following treatment plans,
Very well.
and people not getting well and actually losing their health or their lives because they've decided not to follow. Now, knowing us here in Africa, Nigeria, we're very spiritual people. Whether you believe in God or you believe in Osho, Ogun, like alternate gods, right? Babalawos and stuff like that. Everybody most likely believes in something. It's rare to find an actual atheist in Nigeria. I know we had a couple of them in class back then, which surprisingly,
But they usually believe in something.
they believe in something, right? So let me ask you this. Somebody gets diagnosed with cancer, right? And they're a Christian, and they show up in the doctor's office, in your consulting room, and they say, doctor, it is one witch in my village that is causing this disease, but you're seeing the huge mass and that needs to be resected, and they're telling you, you've just diagnosed me with cancer, but I'm going to go to my pastor. We're going to do 20 days fasting. They have this holy water that would essentially take away the cancer. How do you respond to that, knowing that God can actually heal them, but at the same time, you need to get that mass out? Tell me what goes through your mind in this situation.
So you have just described what we see or what I see in the consulting room regularly. Uh, no, where will I start from? Uh, when people walk in and they're like, "Oh, doctor, what's going on?" They told them that they have cancer, but they believe they don't have the cancer.
Mm-hmm.
And then when you begin to, counsel them that, okay, this cancer or these treatments, oh, doctor, don't worry, they will not need these treatments. They will go and come back. Then when they come back, that even we will be surprised. I get to hear that. I know as a pastor, I've seen miracles, and also I've prayed for people to be healed, and people have said, oh, they had pain somewhere, they had some other form of this, and it happened. I know, but as a doctor, I also have this, doctor's mind, and that helps me to be able to keep the balance.
Yeah.
I know one thing, that if God is able to heal, He does, or let me just say, when the people get healed, we can do tests. We'll see that, okay, you're healed. That's fine. But once the condition continues to persist, I tell them, God is not against medical treatment, number one. Then number two, when you get healed, when you come to me, and then I probably recommend one or two tests, it will be obvious that you're healed. It will be obvious. So if you're not getting healed, things are getting worse. Why don't you, while you're believing God for the healing, why don't you take the treatment?
But the people not consider it like, I'm not having faith. If I'm going to the doctor to treat me, then that means I'm not having faith. My faith will not work. So it's either God or nothing, right? Have you heard that before?
Yes,
Yeah.
a lot of people say that, but
Yeah.
they are not getting things right, because faith does not, fight medicine, or is not against medicine. Medicine is not against faith. And I believe if God speaks to a man and say, "Oh, you are healed, don't go anywhere," and the man hears from God and the man believes it, we will see the results. It will become obvious. Someone cannot be sick for 10 years and the disease is getting worse. And then he's saying he's believing God, and everybody, like, there are Christians that have died. In fact, I've seen people that have gone to people to pray for them, and they had to rush them to the hospital. I've seen people that will say, oh, they will go and come back. By the time they are coming back, the diseases, are all over their body, advanced stage. And the same thing they also do with alternative care. They want to go and take supplement or something. But I tell people, God can heal you, and God can also use the doctors to heal you. So why don't you allow us to treat you while you're believing God for healing? And at the end of the day, if you're fine, it's for your good. I know people will get treatment in the hospital, then they will go to church and say, oh, they will do it as though they didn't get any treatment. That sounds somehow. And
That's
they should have acknowledged the fact that, okay, God used the doctors
to help you
to help them. God is the ultimate, healer. Even doctors, we know. There are times that we have treated patients and nothing came out of it. And we've had, many situations, many, many patients who received treatment from us. And by the grace of God, they were fine. So we have to balance the whole thing. So I tell patients in the consulting room, please, while you're believing God for healing, allow us to help you out. And then also, when you get your healing, it will become obvious to everyone, including the doctors. So don't believe something that has not happened while trying to say you're walking in faith. I don't say God will heal you, go and no. I throw drugs at them. I counsel them about medical treatment.
Have you ever had to pray for a patient in a consulting room before?
No, in fact, it was, I remember on the ward, a patient said, "Oh, I know you're a pastor and you have discussed all of this. I just request that you pray for me." Then I prayed with the patient. But to say that, "Oh, you are sick, let me," no, I don't do that.
Yeah.
I do that in the church.
You default to your medical expertise.
Exactly.
Have you had a patient before where, like, let's get down to, like, let's get it to be real, Adeoluwa. I also, before, I used to be like, there's not really jazz, all this voodoo and juju. Now, like, Joe, no witch can catch me. But, you know, as you grow older, you begin to realize that there's an actual devil out there, and he kind of manipulates, and he has some level of power, but the power of God is exceeds whatever he can do, right?
Wow.
Have you ever encountered a patient before that your pastor, your spiritual sense just says like, there is more to this illness than just medical intervention. There needs to be a spiritual. Have you had that before?
Very well.
Okay, and how did you handle it?
So, like I said, sometimes I don't, this is a podcast, so I need to be careful what I put out there.
Understand, yes.
Sometimes when people walk into my consulting room, I see certain things with the eyes of my spirit. But most of the time, I stay with the medical.
Okay.
I stay with the medical. There are times that, I've had patients that the first day he came to the consulting room, you could perceive the aura. You could designing of spirits. I could. But they didn't come to me. They didn't even see me as a pastor. So why should I minister that to them? I would not even mention it to them. But I knew something was there. So this patient had treatment. And then, you know, there are times you expect patient to finish treatment. As you are done with that treatment, something else will happen. I'm like, okay, this patient is fine, getting well, something else will happen. And then you start treating that. After that one is on, something else will happen. I knew what was happening. That, okay, the spirit is still there. Okay. So I just said, okay, let's just continue the medical.
Yeah.
Because this is not a church. I can't even start doing that here. If I rebuke that spirit and the man starts foaming and he starts, what are you doing in the hospital? It looks somehow. Okay. And then I don't want to give wrong impression.
Yeah.
Yeah. So that is, and I've seen a few patients like that, that that this one, there's something there.
So do you now refer? Because I know there are hospitals that have clergymen who stay in the hospital to pray for in the United States, we usually have like the spiritual leader. Some people will even have what's the name of the Muslim priest?
Islam. I mean, okay, ma'am.
Imam, yes. They do have imams and pastors in the hospital for people who the doctors feel like maybe there needs to be some faith or spiritual intervention. They actually allow it. Is that something that exists in Nigeria where even if you're a pastor, you can refer to a clergy that the hospital assigns as the person of faith that patients can, because culture and faith also, helps in
Yes.
improving the health outcomes, right?
You're actually right. That happens more in what we call the palliative care setting,
I see.
where you know that this patient is going gradually. So you need their faith. They need to hold on to their faith. So the imam will come in, pray with them. The clergy, the pastor will come in, pray with them. The purpose of that is not to pray that they should be healed. The purpose is to prepare them faith-wise for the journey of no return on the earth. You understand? That means on to the other side. Yeah, that's the setting that we have in the hospital, in the palliative setting. And we also have some counseling, moments with patients where you have the psychologists, sometimes the pastors also come in, and then they counsel the patient. So, but when I see things like that, I cannot even refer them to any pastor. What will I put on the referral notes? I design something, counsel. No, definitely not. It's very funny, but that's the reality. So I just treat them with the drugs. I should be able to do things that my colleagues, who are not even pastors or
They
Christian,
can back up.
they are comfortable with, and also things that international guidelines I can defend anywhere in the world. I can defend. Even people can come and say, "Oh, you're not doing the right thing. You didn't treat this person very well." You should be able to say, "Okay, this is what I do. This is what I do." Anywhere in the world.
And it's a standard of
Standard. Thank God, oncology has that setting.
Yes.
The guidelines are the same all around the world.
Right.
Yes.
Right. Amazing. All right. The last question on the spiritual side, then we'll talk about medical tourism and what your thoughts are. Like, are you getting patient? Anyways, we'll get to that. Can you tell us a story, unique story, whereby you were treating a patient and you were like, man, this is looking bad. I need a miracle. You're not the one praying or what, you just thought to yourself, I care so much about this patient. This patient would need a miracle, and that miracle actually happened. Have you had such before?
Okay, so I've had cases where things got bad,
Yeah.
and then we prayed, things got better. And most of these, let me just say, okay, I will say few. And most of the cases that I'm referring to now had to do with uh, not really too advanced cases. You expect the patient to respond to a particular treatment, and the patient didn't respond. Then you switch the drug, and the patient didn't respond. Okay, let me just say this. Uh, you know, okay, I think I can say this now. I've had about 2 or 3 cases where I use unconventional combination of treatment. Just about 2 or 3 cases. I remember this woman then. Is how many years ago now? Going to 10 years ago. But she came in with advanced breast cancer, with tumor in the liver and then in the lungs. And then there are when it comes to regimen, there are drugs you combine.
Yeah.
So when I knew that if I give her that drug, nothing will. It will probably. So what I did is that I was like, okay, what should I do, Lord? I prayed about it. Because I've given her two lines of treatment, and it's as though the thing just remained the same. In fact, the second line, I saw another nodule showed up in the liver. I like, oh, I went to pray. And then the last I combined this drug to combine it. They are both chemotherapy drugs, but not the usual combination. And I gave it to her. And the woman till now is fine. No single trace of cancer in the body.
10 years post cancer.
Almost 10 years.
Liver, that's stage 4 already.
That's stage 4 breast.
Oh my goodness.
So one thing I noticed that even for that woman, she came in, she didn't have much money. There was a time she came in and she wanted to pay me because I told her my fee. She brought out all the money. She's not all these people that use transfer or whatever. She came in with cash. The children would give her money. She was almost 60 something there. She gave me the money. And then when she gave me the money, she mentioned, while in the conversation, she was like, the money she has that she doesn't even have the one to use at home or something. She just said something. And then I like, no, I can't collect all this money for this woman to say. So I removed from that money, gave it to her. She was so grateful. And I've seen her a number of times without collecting a dime. Till today, every year, she will send me Happy New Year.
Yeah.
Every month, she will send me Happy New Month and pray for me. She's doing very well, and all her imaging clear, very clear.
Stage 4 breast cancer.
Stage 4. So
If there's hope for cancer, like even if it's the most advanced stages, people can still get better.
yeah, we can't say that generally,
Not generally, sometimes, yes.
but we are
there's
beginning
hope.
to see that things are changing now. For example, ASCO about 2 years ago, they began to talk about a particular immunotherapy in advanced rectal case where you have deficient MMR. So they found out that with drug like dostarlimab, the whole advanced tumor disappeared. And they checked 6 months, 1 year after, they didn't see anything. So now at this point, we are beginning to say, okay, it's like stage 4 cancer doesn't have cure. We may need to reconsider it later on when the time comes. So things are changing gradually.
Meaning there is more hope for cures for stage 4 cancer now than we had before.
Exactly.
Interesting. Wow. Thanks for sharing that story. I'm intrigued, especially in Nigeria. Of course, stage 4 cancer can be, cured in some cases, but it's not that common, especially when it's expensive, access to care is not that great. And so thank you for what you're doing, especially even just having the heart, like to understand the financial aspects, the social determinants of health aspects of how it affects the patient. Let's say she paid you all that money and she goes home and not able to eat for the next 1 week. And then what, you know?
I'm also a pastor, so there are certain things I will not do.
Exactly. So
And
your
also being a
compassion.
Christian also.
Exactly. So being a healer as a doctor in quote, it goes beyond just the medical knowledge. It also includes being discerning of the patient needs, their nutrition, their financial wellness, their emotional wellness, their mental health as well. So all of those things play into cancer care. The other thing I want to talk about, and we would wrap up, is about medical tourism, right? You're such a stellar doctor. You're doing such a fine job, helping your patients. Have you had patients travel from outside the country just to come and see you? Do you cross-pollinate between here and outside the country, like give second opinions? Or do you send patients outside the country to say, you know what, there is this country or doctor in another place that can help you? Like, what does that look like for you? Or generally in Nigeria, even the medical tourism for cancer?
Okay. Nigeria